Health professions at the makeshift clinic set up in Kanana Village in Hammanskraal continue to treat patients presenting with mild cholera symptoms. This is whilst burials of the 21 in the area that succumbed to the cholera outbreak are being buried. Health Minister Dr Joe Phaahla says the clinic will prevail until the cholera outbreak subsides. My colleague Offenses Timo is currently monitoring that story out in Hammanskraal, and we will cross to him live now.
Well, I can tell you that there is a hive of activity here at Kanana, where there is a makeshift clinic that has been set up. As you know, that this is the epicenter of the cholera virus, of the cholera outbreak that actually broke out and has actually affected about 22 people. 21 in Hammanskraal and only 1 in the Free State. Well, there is, as I mentioned, the hive of activity. If I can just get out of camera so that you can see what it's actually transpiring. There has been about 10 patients that have actually been treated for mild cholera symptoms overnight. And fortunately, because their symptoms was actually very light, they were not admitted. There's actually an ambulance on standby should any of the people come here with severe symptoms that would actually warrant further medical assistance. And if I can just come in there, well, this morning it was very somber as some of the deceased were actually getting buried in different cemeteries. We were at the funeral of 69-year-old Solomon Manamela, whose family was actually saying that they were actually looking forward to a long life with him, as much as he was actually grappling with a long illness. They were expecting him to actually live beyond the 69 years that he was. He was actually expected to turn 70 in October this year, and it's something that they were anticipating to be a big milestone. They were expecting to celebrate with him, but unfortunately, after drinking water, he started showing symptoms of diarrhea and also throwing up, and unfortunately, shortly after that, he succumbed to the cholera virus, that is.
Offense, about the mobile clinics that have been set up, do we have a duration of just how long they'll be there? And I think I heard you saying there is an ambulance. Is there only one ambulance for the entire community of Kanana?
Not really. Actually, earlier on when we were here, there were quite a number of ambulances and emergency staff that was actually on standby in case people present themselves with severe symptoms. And when we spoke to the minister yesterday, he explained that, there's no duration. They don't know until when this clinic is actually going to be here. But one thing for sure, once they can start seeing less and less people showing symptoms of diarrhea or running stomach or similar symptoms, then that's when there will be an indication to show that actually, their work here could be done. But they actually elaborated to say that they need to ensure that there is actually a day or 3 days where there's no patient that actually presents themselves with symptoms that are similar to those of cholera. Then they can decide that no, maybe they can close shop here at Kanana, which is actually the epicenter, as I mentioned, that a lot of people from this particular village are the ones that have actually been affected by this cholera outbreak.
You related a very moving story of Mr. Manamela, and you said that he was about to turn 70 years old. That means that there must be a lot of anxiety among the family members themselves. But I'm more concerned about what the atmosphere is like around Kanana. When you walk the streets of Kanana, what are the people saying? How are they dealing with this and the anxiety that comes with not knowing whether what you are consuming is safe or not?
Absolutely. Like similar to the feelings and emotions of the Manamela family, residents here in Kanana are actually very anxious. They are saying that, they've been living with this water for quite a while with very low or less intervention by the powers that be at the municipality to try and address the situation. So they are saying that over time, they sort of got used to drinking the water, boiling it, even though when you drink tea or coffee with this particular water, it tastes different. It doesn't taste like your normal water. So they were saying that they are appealing to the government itself, especially for those families that are still grappling with burying their loved ones. Some were actually caught off guard to say that if they can assist with food parcels or any way they can actually assist, it would actually go a long way.
before I let you go, Offense, we understand that there were supposed to be water tankers dispatched to the areas, and I believe that Kanana must have been one of those. Are the residents using those facilities? And I'm sure the trust factor is now very low, because even though you have water that is deemed to be safe, but when you know that you have lost family members, you've lost neighbors, the trust factor really goes down, and you're not quite sure if this water that is brought by the water tanker is quite safe. What is the situation with the water tankers?
Well, we've seen a few water tankers actually, traversing the length and breadth of Hammanskraal, actually trying to, allocate water for the residents. But what we have established from the city of Tshwane is that they've actually cut the water provision from, I think it was 5 or 7 days to actually 3 days. So you can imagine that the scarcity of water itself could result in residents actually trying to find alternative means in order to get the water. But some that we spoke to that were passing here at the Field Hospital were actually telling us that, they've been grappling with this problem. They've been buying water, and they feel that even if you boil this water, they are not quite confident that it could be suitable for human consumption.
Offensive Stimo, thank you so much for updating us, and no doubt that we will be catching up with you later to find out if there has been any developments with regards to those mobile clinics and also the funerals that are currently taking place in Kanana out in Hammanskraal.